Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi and our online audience tuning in. Thanks to our friends at iHeartRadio and Amazon Music Podcast. Glad you all could be with us. Well, as we've been talking about on this program, we know that the coronavirus has definitely hit communities of color the hardest. And because of that, we are now getting a bigger spotlight on some of the issues that have affected these communities for decades. We're talking about access to health care, healthy food, education, and family income, and how all of this can impact health. Because of that, in honor of Black History Month, the American Heart Association is focusing on not only individuals who are making an impact, but Black social entrepreneurs who are working to address these factors and to be able to provide some solutions. We're talking to two of those individuals today. We're excited to welcome Andrew Suggs, the CEO and founder of Live Chair Health, as well as Abner Mason. He's the CEO and founder of ConsejoSano. We're going to talk to the two of them not only about their organizations, but also where you can find out more information. Andrew, Abner, thank you so much for the time. Really appreciate it.
Thanks for having us on.
Okay, glad to do it. So, Abner, I'm going to start with you. I mean, I use the term Black social entrepreneurs, and of course, a lot of our audience are familiar with the term entrepreneurs. What is a social entrepreneur?
A social entrepreneur is a founder like Andrew and myself who create companies. They can be for-profit or not for-profit, but that have as a central mission to improve or have a positive impact on society. So while in my case I run a for-profit, I have to be profitable. Just as important is the impact, the positive impact we have on the communities that we work in. That's what social entrepreneurship is all about.
It was interesting when I was prepping for your segment for the two of you to find out more information about your organizations. Abner, to stay with you for a moment, I noticed in a video you did a few years ago in a presentation, you talked about back in 2001, what kind of led you down the path that you're on now. I mean, what has it been like for you to see the difference you've been able to make with your organization?
It's, the journey of an entrepreneur, and I know Andrew shares this. It's not easy because you're building something out of nothing, but it's really gratifying. It's hard work. In my case with ConsejoSano, we're a patient engagement and patient navigation company, and what we're doing is trying to solve a problem that exists in the U.S. that the healthcare system in our country hasn't kept up with the demographic changes. We have a very diverse country. We're on the way to becoming majority minority, but the healthcare system still operates like it did in the 70s, and that produces poor health outcomes and higher costs for society. So we're using technology and a lot of data to build much more customized, personalized engagement strategies to connect with people, build trust, and then navigate them into the healthcare system at the right time and at the right place. Since I started the company, we've had a lot of success. We're in 15 states now. We're serving about 2 million people, and we're growing a lot. And part of that growth is because we're getting funding, and funding has been difficult. I'm African American. It's hard to get investment when you're an African American entrepreneur, and I'm sure Andrew shares this. So that's why we're really gratified by what the American Heart Association has done, which is to provide funding to organizations like ours, both through grants and, interestingly, a new approach, direct equity investments into for-profit companies like mine. AHA has a new fund called the Bernard J. Tyson Fund that invested in my company. So I'm super excited about that. I think it could be a model for the future. We need more solutions and better solutions like what Andrew is building and like what I'm building, but we need support to do it.
Yeah, Andrew, to go to you, I noticed when I was prepping for this, Live Chair Health, what you have been able to do and, kind of taking what is a staple in our community when it comes to the barbershop experience and taking those conversations higher. What has it been like for you to see, Andrew, the way that Live Chair Health has been able to make a difference?
Yeah, so I think the first way that we've been able to make a difference is to engage, access, and influence people that have been marginalized from the healthcare system. And so it's simple, from having members who have taken a blood pressure reading and they've fallen in hypertensive crisis levels, and now with the help of Live Chair Health, their blood pressure is stabilized at 120/80. I think that's one success, story. We have multiple success stories like that. And I think it's important that we realize when people or individuals live healthier lives, it does not only just impact them, but those who rely on them. So as an example, a gentleman who's screened at 175 over 120 blood pressure, he's now stabilized, but he lives longer to be around for his 4 children. So, the impact goes multi-generational, just not beyond just the individual.
So, Andrew, I want to ask you this question and then go back to you, Abner. What do you hope individuals listening to this conversation realize about what's possible when it comes to not only being, a social entrepreneur, but also making a difference in their community?
I think you can do well by doing good. That's number one. And so at Live Chair Health, we're building networks of non-clinical and clinical resources and in-person and digital services. So being able to combine that high-tech encouragement, high-touch encouragement from hair professionals, and then the high-tech and digital and in-app nudges to encourage clients and help them address health disparities is something that, we really, put our stake in the ground and say this is what we're here to do. We want to create a system that's equitable for all.
All right. And, Abner, what about you? What do you want our audience to know about what is possible for them when it comes to making a difference in their community?
I'd echo Andrew's points that, the need is great for new solutions. And again, one size fits all. People like them, they know their communities best. And so they need to have the courage to believe in their own ideas and then to find allies who can help them. In our case, Andrew and I, the AHA has been a great ally. So I would suggest the American Heart Association, but we want to encourage other groups to be allies to entrepreneurs who look like Andrew and I, and who are trying to build solutions that meet the needs of people who have just been underserved so far by our healthcare system. I'm optimistic about the future, but I'm optimistic because there are smart people out there who have ideas, who have solutions. I just want to encourage them to step up and put their ideas in action.
All right, Andrew and Abner, thank you so much for the time. Really appreciate you all stopping by.
Thanks for having us.
Thanks for having us.
Glad to do it. And we thank your audience for tuning in to another great segment of Conversations Live. You guys can go to heart.org/Black History Month for more information. Again, that's heart.org/Black History Month for more information. Again, we appreciate Andrew Suggs and Abner Mason stopping by to talk about the work that they're doing and reminding you all about what you can do in your own communities. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.